Have you ever wondered how nursing homes and Medicare coverage truly intersect? It's an intriguing question, isn't it? One that could dramatically alter your perspective on healthcare in America. As we delve into this topic, we'll be peeling back the layers of an intricate system that impacts millions of lives. We're about to embark on an investigative journey, and we promise the revelations might just shock you. Stay tuned as we uncover the shocking realities of Medicare coverage in nursing homes. Nursing homes across the country promise to provide quality care for our loved ones. Imagine a place where the elderly, the frail, and those in need of round-the-clock care are promised a safe haven. These institutions, these nursing homes, are presented as pillars of compassion and care, sanctuaries where our loved ones can live out their golden years with dignity and comfort. But let's delve deeper. What is the current state of these nursing homes? Are they truly the havens they promise to be? Across the nation, nursing homes are often understaffed, leading to a high patient-to-nurse ratio. This can result in compromised care, with nurses stretched thin and unable to provide the level of attention each resident deserves. It's a harsh reality that many families face, the promise of quality care, overshadowed by the reality of overworked staff. And then, there's the elephant in the room: Medicare. Medicare is a federal program that provides health coverage for individuals age 65 and over. It's a lifeline for many seniors, and a significant portion of nursing home funding comes from this program. But here's the catch: Medicare often only covers short-term stays and specific types of care. Long-term care, which many nursing home residents need, is often not covered. This leads to a critical question: who foots the bill when Medicare falls short? The burden often falls on the families, many of whom are ill-prepared to shoulder such costs. It's a financial strain that can lead to difficult decisions and compromises in care. And let's not forget the emotional toll. The guilt and worry that accompany the decision to place a loved one in a nursing home are profound. And these feelings are only amplified when the reality of care does not meet the expectations set by the nursing home. But what if the reality is far from what we are led to believe? As we pull back the curtain on nursing homes and Medicare coverage, we uncover a reality that is often hidden from view. It's a reality that calls for awareness, understanding, and ultimately, action. Medicare is often seen as a lifeline, a safety net for those who need it most. It's a beacon of hope in the twilight years for millions of Americans, a promise of support when they need it the most. But what happens when that support is not as comprehensive as one might believe? What happens when the very system designed to provide aid falls short? Let's delve into the untold story of Medicare and its coverage for nursing home care. Medicare is a federal program that provides health coverage for people aged 65 or older or with certain disabilities. One of the services covered under Medicare is Skilled Nursing Facility, SNF care. Now that sounds reassuring, doesn't it? But here's the catch: Medicare's coverage for SNF care is not as extensive as most people believe. Firstly, Medicare only covers short-term stays in skilled nursing facilities, typically following a hospital stay of at least 3 days. It does not cover long-term or custodial care, which constitutes the majority of nursing home stays. This is a critical distinction that many are unaware of until they or their loved ones need long-term care. Secondly, even for short-term stays, Medicare only covers the full cost for the first 20 days. From the 21st day to the 100th day, a co-payment is required. And beyond the 100th day, Medicare provides no coverage at all. This financial burden can be overwhelming for many families. Another surprising fact is that Medicare's coverage is contingent on the patient needing and receiving daily skilled care, such as physical therapy or intravenous injections. If the patient's care needs do not meet these criteria, Medicare coverage does not apply. Additionally, while Medicare Part A covers hospital care, home health services, and hospice care, it does not cover routine personal care assistance, a vital part of the service provided by nursing homes. This gap in coverage often forces families to make difficult decisions, such as depleting their life savings or relying on Medicaid, a program for low-income individuals and families, to cover the cost of long-term nursing home care. As you can see, the truth about Medicare coverage in nursing homes is far more complex than many realize. It's essential to understand these nuances to navigate the labyrinth of healthcare coverage effectively and ensure that our loved ones receive the care they need and deserve. Now, let's delve into the shocking facts and figures that our investigation has uncovered. As we peel back the layers, the reality of nursing home care and Medicare coverage in the United States becomes increasingly stark. It's a jarring realization that over 2/3 of the nation's nursing homes are for-profit entities. Yes, you heard that right, more than 2/3. Now consider this in relation to the quality of care. A study conducted in 2021 found that for-profit nursing homes were associated with lower quality of care and higher rates of rehospitalizations and emergency room visits. But the disturbing revelations don't stop there. Our investigation has found that nearly 1 in 5 nursing home residents are given antipsychotic drugs, whether they have a diagnosis that warrants such medication or not. This practice can have serious, even fatal implications for the health of these residents. And what about Medicare coverage? You might think that the government's health insurance program for seniors would provide comprehensive coverage for nursing home care. But the reality is far from it. Medicare only covers a maximum of 100 days of skilled nursing facility care per benefit period. Moreover, the coverage is not even continuous. For the first 20 days, Medicare covers the full cost. However, from the 21st to the 100th day, the resident is required to pay a hefty coinsurance, which in 2024 stands at a staggering $178 per day. And the most shocking fact? After the 100th day, Medicare coverage for nursing home care ceases entirely. That's right, no more coverage. This leaves many seniors and their families facing enormous out-of-pocket expenses, with many unable to afford the care they desperately need. But it's not just about the money. It's about the quality of life for our elderly population. It's about dignity and respect in their twilight years. It's about a system that seems to prioritize profits over people. These figures paint a sobering picture of the state of nursing home care and Medicare coverage in our country. It's a wake-up call that we can no longer afford to ignore. We need to demand better for our seniors because they deserve nothing less. Armed with this knowledge, it's time for us to take action. We've journeyed through the realities of nursing home care, unveiled the untold stories, and faced the shocking facts and figures. It's clear that the system is flawed, and it's up to us to bring about change. It's easy to feel overwhelmed by the magnitude of this issue, but remember, change often begins with a single step. The first step we can take? Spread the word. Share this video with your friends, family, and colleagues. Post it on your social media platforms. Start a conversation. Knowledge is power, and by sharing this information, we're empowering others to join us in advocating for change. But let's not stop there. We can take our advocacy a step further by reaching out to our elected officials. Send them an email or a letter, make a phone call. Better yet, arrange a meeting. Let them know that the state of nursing home care and Medicare coverage is a matter of urgent importance to you. Remember, our representatives are elected to serve us. It's their job to listen to our concerns and to act on our behalf. While we're pushing for systemic change, let's also support those who are directly affected by this issue. Visit a local nursing home, volunteer your time, donate to organizations that are working to improve the quality of care in nursing homes. We can also educate ourselves further. Read up on the issues. Stay informed about the latest developments. Join or start a local advocacy group. Attend town hall meetings and public forums. The more we know, the better equipped we'll be to contribute to meaningful change. Finally, let's remember to show compassion and empathy for those who are caught in the midst of this crisis. The elderly, the disabled, the chronically ill, they're not just statistics. They're our parents, our grandparents, our friends. They're people, just like us, who deserve to be treated with dignity and respect. We've shone a light on an issue that too often remains in the shadows. Now it's our turn to act. It's our turn to stand up for those who can't stand up for themselves. It's our turn to fight for a system that respects and values the vulnerable among us. So let's roll up our sleeves and get to work. Let's be the change we want to see in the world. Share this video, spread the word, and let's ensure that our loved ones receive the care they deserve.